So social distancing. So it's about avoiding contact with someone who is displaying symptoms, which is, common sense. But actually, if, as you saw, that whole bunch of symptoms, somebody could be suffering with the common cold, it could be having some flu symptoms, it could be a worsening of their asthma, it could be a sinus problem. There's a whole load of other medical problems that can cause similar symptoms. And people may think, actually, you know what, it's okay just because I've got a cough, it's my yearly cough. Actually, what the advice is now is that we need to completely avoid contact with those symptoms because they could be coronavirus. So avoiding the non-essential use of public transport, obviously that's a closed environment, and people at high risk of transmitting to one another. There's the encouragement of working from home where possible. So initially the advice came out that actually it should be, only essential workers should be going to work. But actually, no, the advice is, and actually the interpretation is that anybody who cannot work from home should still be going to work. So because of life still has to continue, people still need to earn a living. And there is a section later on, especially for self-employed people who might be working in trades and having to work in people's houses, etc. They can actually still do that as long as they follow certain rules and certain precautions that they're taking. And then the other thing, especially important for people in the Muslim community, in the Asian communities, is the avoidance of large and small gatherings, and in public spaces, but also in our own houses. And this is obviously touched home for us, a very difficult situation in terms of suspending congregational prayers, suspending Jummah prayers. But I think that was an absolutely correct thing to do, because even now we're seeing that actually such a high percentage of Asian and Muslim people who are succumbing to or have succumbed to coronavirus because of the way we have our community is so close-knit. Our communities have a massive sense of sharing, and the whole culture of welcoming guests into our houses and going to there's a lot of cultural issues there, and unfortunately we've had to put a stop to it, but it's necessary to prevent this from spreading and to prevent it causing more harm to ourselves and others. So why is it important? This is a really good graphic. I'm just going to try and pause it there. So this just describes, just go back, sorry. So it just shows how if you have one person spreading, how at the end, so the theory is that one person, I don't know if you can see my mouse on the screen, but the dots right on the left-hand side of your screen is the first person, is one person who's got coronavirus. That one person is theoretically could spread to around 2.5 to 3 people. So if that one person goes about their normal life and spreads it to 3 people, those 3 people going about their normal life will spread it to 3 people, or 2.5 or 2 people each. Those people will then spread it to 2.5, 3 people each. And by the end of the month, one person, after 30 days, you could have 400 new cases of this virus spreading around in the community. So you can see how exponentially it increases. However, by doing social distancing, so just by reducing our contacts even by 1/3, what happens is that you get this massive reduction because the knock-on, the domino effect stops. And it just requires a bunch of people to stop meeting others or stop going out and to socially distance themselves. So this one person only passed it to 2, those 2 people only passed it to 4, the next 4 people only passed it to a few more. And what happens is you get this massive reduction by the end of, in terms of the transmission. And this is why social distancing is really, really important. Because what happens is if there's not enough people for that virus to then spread around, the virus can then no longer survive, and therefore the virus then disappears. And that is the theory. And I think we are seeing that. We've seen that in China. We've seen that very well in South Korea, where they were very diligent in locking everything down. And then I think now, hopefully, inshallah, we'll see this here in the UK as well. And are people who are continuing to socially isolate and socially distance themselves, following the guidance on staying home. If that continues, inshallah, I think we'll see that it has a good effect and will reduce down the number of potential infections. So it's just a really good slide. You may have seen other slides. There's other examples where you've got matchsticks all lined up. And that, a matchstick will pass on fire to another matchstick, etc., etc., etc. But if you take one matchstick out of there, you're breaking the chain. You're breaking the chain of transmission, and then it means that you might be stopping that infection going on to other people.